by example.
Yep. All right, everybody. I'd like to welcome everybody to the Commissioners' Conference with the Pledge of Allegiance. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'd like to welcome everybody. This meeting is now to order. Karen, any unfinished business or correspondence?
I have nothing.
Excellent, thank you very much. Looking for a motion to approve the minutes of the meeting dated April 28, 2020 as presented.
Second.
Properly moved and seconded. Any discussion? Hearing none, call for vote.
Mr. Mattson?
Yes,
Mr. Bullard?
Yes.
Mr.
motion carries. Next on the agenda, looking for a motion to approve invoices in the amount of $1,232,428.17 for period April 28 through May 12, 2020.
Second.
Properly moved and seconded. Any discussion? Hearing none, call for a vote.
Mr. Mattson?
Yes.
Mr. Bullard?
Yes.
Mr.
Yes.
Sargent?
Motion carries. Next on the agenda, looking for a motion to approve pending invoices in the amount of $508,238.67.
Second.
Properly moved and seconded. Any discussion? Hearing none. Call for vote.
Mr. Mattson?
Yes.
Mr. Bullard?
Yes.
Mr. Sargent?
Motion carries. Next on the agenda, looking for a motion that the actual gross payroll in the amount of $237,808.51 be approved for payment for the period April 12th through April 25th, 2020.
Second.
Properly moved and seconded. Any discussion? Hearing none, call for vote.
Mr. Mattson?
Yes.
Mr. Bullard?
Yes.
Mr. Sargent?
Motion carries. Next on the agenda, looking for a motion that the tentative gross payroll in the amount of $248,600 be approved for payment for the period April 26th through May 9th, 2020.
Second.
Properly moved and seconded. Any discussion? Hearing none, call for vote.
Mr. Mattson?
Yes.
Mr. Bullard?
Yes.
Mr. Sargent?
Motion carries. Next on the agenda, would like a motion to award the construction of contract number CDBG-C18-01 Borough Big Run War Memorial Building Roof Replacement Project to the low bidder Shield Roofing and Construction Company, LLC, in the amount of $888,400. This award is contingent upon the contractor fulfilling all contract requirements. In addition, this motion authorized the chairman of the board of the county commissioners to execute all contract documents with Shield Roofing and Construction, LLC, including any change orders to the contract.
Just one thing, Jack, when you read that, you said 888.
Oh, sorry. That was the fog in my glasses. I apologize. That's $88,400. Thank you for that adjustment.
Second.
Properly moved and seconded. Any discussion? Bill Cetri.
Yes, we received 5 bids for this project, with 1 bid being rejected for not submitting a bid bond, and the other required bid documentation. The bids ranged in price from a low bid of $88,400 to a high bid of $156,820. The engineer has reviewed all bid documents, checked references, and recommends awarding the bid to awarding the contract to the low bidder, Shield Roofing and Construction.
Excellent. Thank you, Bill. Any other discussion? Hearing none, call for a vote.
Mr. Mattson?
Yes.
Mr. Bullard?
Yes.
Mr.
Yes.
Sargent?
Motion carries. Okay, that's all our general business. Next, I would like to open the floor or give the floor to our Director of Emergency Services, Tracy Zentz, for our COVID-19 Jefferson County update.
Thank you. I'm just going to kind of give you a brief overview of where we came from and then where we're at today, if that's okay. So the county, we had started our planning in response to the COVID on February 27th. The governor followed up with a declaration on March 6th, and our first resource request for personal protective equipment was filled and completed on March 13th. The county developed a task force to deal with the COVID on March 16th. And this included not only the hospitals, schools, long-term care facilities, different chamber of commerces, law enforcement, and some of our local and state partners, which we continue to meet weekly to discuss the pertinent activities and responses. Our first letter was sent out to the municipalities on what to expect and prepare for in the pandemic on March 17th. The county declared a declaration on March 18th, followed by the County Emergency Operations Center moving to a level 3 activation for monitoring and planning. Upon the activation of the EOC staff started to reach out to first responders, municipal leaders on their supply and availability of the personal protective equipment, and additional resource requests were being filled from the county supplies as needed. Additional PPE was requested through the state and through private vendors at that time. We've had numerous conference calls, meetings to discuss the ever-changing dynamics to this event, to keep our first responders, municipalities, hospitals updated as they prepare, to be as prepared as possible. The municipalities started to declare disaster declarations for their respective municipalities on March 17th so they could prepare for a potential outbreak. The governor declared the closing of all non-life sustaining businesses on March 19th. The stay-at-home order was ordered on April 1st, and Jefferson County seen its first COVID case on April the 6th. The stay-at-home order was extended until May 8th, and Jefferson County was one of the first 24 counties to be included in the transition to the yellow phase. The EOC, the Emergency Operations Center, was moved back to a level 4 normal operations on May 8th, as the COVID situation was still busy for us at that point, but it was manageable from a day-to-day standpoint. So as of today, the county is still in the planning and response phase, but we're also starting to move into the recovery phase. And this phase is going to be indefinite, depending how long the situation goes. We have filled a total of 87 resource requests for personal protective equipment. This includes from our first responders, our police, fire, EMS, hospitals, nursing and long-term care facilities, municipality, and associated county government offices. Working with the county election staff to supply them with items to keep the poll workers safe. We continue working with our hospitals, long-term care facilities to meet their needs as well. And we're continuing with our periodic pushes of PPE to our first responders, jail, and other critical essential services from the Strategic National Stockpile, FEMA, and the Department of Health. And we're also continuing the planning for potential testing and vaccination support as needed, as well as a potential for a second wave of the virus. So as of today, the case count in Jefferson County is still at 7. A total of 381 of our residents have tested negative. And I want to share that our thoughts and prayers continue to go out to those with the virus on a speedy recovery. We can recommend to everybody to continue to practice the good mitigation measures. It's for you and your family's health, and that's what got us to where we're at today. With the low numbers, we want to keep them low. So we ask everyone to continue to do their part to prevent any kind of community spread. We will continue to evaluate our response to make it better for our county. One of the questions that I have for myself is, has our response been perfect? And I will say it hasn't, but we continue to look at ways to improve our procedure and processes for all our stakeholders. And I want to say thank you. Thank you for everyone for doing their part. And that's all I have right now, unless there's any questions for me.
Thank you very much, Tracy. I don't see any questions. There's no one on the conference call, and I don't see any questions on our live chat here. Any commissioners, you want to add anything to that?
Yeah, just thank you and your staff and your volunteers for everything you did. You put in a lot of hours for the safety of everybody in Jefferson County, and you're commended
Thank
to
you.
do that. Thank you.
Teresa, I'm just gonna ask the personal protection.
Mhm.
Is there in excess now? I mean, is there stuff more readily available, or is it still order and wait, and how's that work?
It's still in an order and wait type situation, where some things have been able to come back online a lot quicker. We're still awaiting the masks, especially N95s, surgical masks, those kind of items, because they're still in high demand. We have placed a potentially large order for masks, I want to say back the first part of March, and we're still awaiting those. Now, we were told that the week of the 11th, which is this week, that we should start seeing some of that. We are starting to see supplies coming in from the Strategic National Stockpile through PEMA and Department of Health. That was relatively slow to begin with, but thankfully we had a cache of those supplies in hand that we were able to get out to the first responders and the community as needed. So we never ran out of PPE here. It's just the distribution formula that we come up with to get it out as quickly as it comes in. So we'll be putting out another push to the first responders here by the end of this week, first of next week, once we have those shipments in. And one of the things that's definitely helped out is that the Federal Emergency Management Agency is now pushing out PPE on a regular basis to the nursing homes, long-term care facilities. So that takes a little bit of that extra burden off of us at this point. We'll still be there to support them if we have the supplies that they need them on a critical need. But that should help us out and getting our stockpile back, getting those items out, and potentially planning for the second wave to have what we need in place now. So I know that was kind of a long answer to the question, but I thought it was important to share
Thank you.
that. So.
Good job, appreciate it.
Tracy, what do you know about testing in the area? I mean, we have adequate testing in our hospitals? Is there any shortage on that side?
Well, part of the collaboration that we've had with our stakeholders is we've had good communication with them going through. So the hospitals have been testing what they could on a limited basis based on the amount of test kits that they have. They have more of a supply of that now, plus a lot of the physicians, personal care physicians, doctors off, so forth, are able to test now too. So they're doing some of those testing as well and reporting all that back then to the Department of Health channels.
Okay.
So it is improving. We still, there is still some needs for some of that, but I think for our sake here, we're not as critical as we were to start with. So.
Thank you, Tracy.
Yeah.
Well, I mean, it's Jefferson County. We've been blessed. We were the last county to get a confirmed case of COVID-19. We're among the first counties to transition from the red to the yellow phase. Our plan as commissioners and Department of Emergency Services, Economic Development, the whole county is to keep getting back to our new normal. I don't think anyone believes that our normal is going to be exactly like it was in December. But we're pushing really hard to try to figure out what our new normal is and get there safely, responsibly, but also quickly, because when we can, because I know we can feel our citizens getting antsy and want some answers and clarifications. And we feel the same way. We're trying to get those similar answers and some clarifications on what this looks like. What's the next phase? We're asking the important questions, and we're trying to get those answers to keep us safe and to keep us moving in the right direction. So appreciate all the cooperation, the help, whether you're county or whether you're an employee or a citizen, a first responder, frontline defender, essential worker, or if you're unemployed. I mean, we're all in this together. We're all trying to go in the same direction as a community and do what's right. We don't know what this disease is. We don't know, we don't know all the facts around this. All we're doing is trying to clear out all the rumors and concentrate on the facts. I mean, that's part of the job that Tracy and his team does an excellent job of, is taking the rumors that you see off of social media, off of even other posts, the emails, and finding and digesting that and what is actually factual. And that's what we do every day. We try to figure out what is factual and then what is the plan around those facts. And we're going to keep doing that. But I appreciate it so far. We have been blessed. Not 100%. There have been fatalities in the region. I don't believe we have had one recorded fatality in our county, but we have had fatalities due to COVID-19. And we've also had probably had some health issues because of COVID-19 that were related to COVID-19, but it wasn't the disease itself. Appreciate everyone's continued patience. I don't see any questions up here. So there's just a couple other announcements that we have. I guess we're not at the right part of that. So a couple of announcements. Well, anything else on COVID-19? Thank you, Tracy. Let's see. All offices will be closed on Monday, May 25th, 2020 in observance of Memorial Day. The next commissioner meeting is May 26th, 2020 at 10:30 a.m. in Jefferson Place. It is also mine and my wife's anniversary today. You probably won't see her because she is at home with my kids. But I was going to say, if you see her, please wish her a happy anniversary, but I don't know if you will. Next, one of the important things is census. It is census time. If you haven't completed your census survey, please already do so. Bill or Jeff, do you know where we are in the county on the percentages? We're just, is it 50 yet?
No, last time I looked, it was around 45%, I believe.
45, 46, that's what, 2 weeks ago.
Right.
Yeah, so get your censuses filled out. Those census dollars, they're confidential, they're private. They only use they use that information for a number of those things. But one of the most important things is that's how we get federal money assigned to our communities. So please fill out your census and be counted. Any other announcements that you guys can think of?
Election, we got election in 3 weeks. 3 weeks, right, Karen?
Correct.
So Karen and her group is processing mail-in ballots, and they have a lot. So hopefully by the end of this week, most of them will be mailed out. So they've done a really good job, and with a couple other staff in the office that have helped. So one thing with mail-in ballots, that if you request one, you will get one mailed. And it's up to you to get it back, and you have till 8 o'clock on election night to deliver it here. So if you do go to the polls, you will not be able to vote there again. So you can only vote one time. So it's pretty common sense, but again, if you requested it, you'll be getting one in the mail.
Thank you, Jeff. Anything else before I open the floor to public comments? All right, I'm opening the floor to public comments. I do have, at least someone is watching, because I have a happy anniversary message on there. That's pretty cool. Thank you very much.
Probably.
I mean, it is crazy because I am in a little bit of trouble, honestly, because I don't really have been thinking of dates. It's more months. I've been thinking April and May, and I woke up this morning and got a text from my wife that said happy anniversary, and I really, honestly, the first time in my life, I had no idea that it was the 12th. I know my anniversary is today, but I just didn't register. So. Any other public comments? I don't see anything, so we'll close public comments at this time. Questions, comments from the press? There's usually a lag. All right, I don't see anything there, so looking for a motion that this meeting be adjourned.
So
Second.
Properly moved and seconded. Any questions? Discussion. Hearing none, call for vote.
Mr. Mattson?
Yes.
Mr. Fuller?
Yes.
Motion carries. Thank you, everybody.